House went over, but it was a productive call, and I'm happy to be with you and all the people of Rhode Island now as we begin a new week together dealing with the coronavirus pandemic. It's a beautiful warm day out today, as it was yesterday. I hope you have an opportunity to get outside and enjoy the spring air. It's good for your mental health, good for your physical health. So I'll begin, as we always do. The numbers are going to come up on the screen. I think these numbers are a good news story. We have 175 new cases, which is, less than a little bit less than we've been having. You'll see hospitalizations are very stable and have plateaued. So that's all a good news story. It shows that the virus isn't running away with itself. We're on top of it. It's stable. We've made good choices, and we've done as well of a job as we could. Very sadly, there are 21 additional deaths. Dr. Nicole will go through the details of that. And I would just ask us all to remember the toll that this crisis is taking on so many families in Rhode Island, especially those who've lost loved ones. I want to say this. I'm going to start to give some guidance around how we think about phase one. But I just would ask everybody to pause for a half a second and think about where we are and where we've been. So we've been at this now for just about 2 months. That's something to really think about. On the one hand, it seems like we've been dealing with this forever. Kind of hard to remember life pre-coronavirus. On the other hand, it's only been 2 months. And as I think about all we've done together as a community to deal with this crisis in the space of only 8 or so weeks, I have to say I've never been prouder to be a Rhode Islander. Rhode Island has really risen to the challenge over the past couple of months in so many ways. Our leaders have risen to the challenge at the National Guard, municipalities, mayors, legislators, my own team, hospital executives, so many leaders have stepped up. People in the trenches working on the ground every single day in our hospitals and nursing homes and grocery stores, often without a day off, have just kept Rhode Islanders safe and healthy. It's unbelievable. And every day, Rhode Islanders have reached out to help their neighbors in ways big and small. From manufacturers calling me directly saying, "Hey, Governor, I see you have a shortage of gowns. We think we can help," to the simple gestures of kindness, looking in on a loved one, calling someone who you know might be lonely, sending a smile emoji to someone who's having a tough day, delivering groceries for somebody who's elderly, and then retooling the whole way we live. So although this is traumatic and difficult and mostly has been a nightmare for all of us, I have found inspiration and courage and hope, actually, in seeing the resilience and kindness and generosity of the people of Rhode Island. And it has been why we are able to be as successful as we've been in limiting the loss of life and hospitalizations of the virus. So I want to thank you for that. I also want to give you some statistics to let you know what a good job you're doing. So as you know, I was a little worried about the weekend. It was a gorgeous day, both days. We had a lot of people out and about enforcing social distancing in our parks, on our roadways. By and large, Rhode Islanders were very compliant. Not perfect. We definitely had to break up some crowds. We had to insist that people separate from each other or put their mask on. By and large, however, you did a great job. And that should give you confidence. I want you to feel confident that if you continue to do these things, wear your masks, wash your hands, stay home if you're sick, stay 6 feet away from people, it's going to be safe to come out increasingly as we go forward. Here's another statistic. Over the weekend, the Department of Business Regulation inspected on over 300 businesses. So in unannounced visits to over 300 businesses all across Rhode Island, they reported a 95% compliance rate of customers wearing masks. And they reported nearly 100% compliance with people staying 6 feet apart, especially when they were waiting outside to get into the store. That's fantastic. If, as we go forward in reopening our economy, we continue to see that kind of compliance, everyone's wearing their mask, sick people are staying home, everyone is staying 6 feet apart, then we're going to get this economy up and running, and you can feel safe to go out again because folks will be doing what's necessary to keep you safe. So with that, I want to offer a few thoughts about what phase one of our reopening might look like. As I stand here today, looking at all the data, looking at hospitalizations, checking in this morning with hospitals, it is my hope and intention to lift the stay-at-home order when it expires on May 8th. A number of you have commented to me that that is sooner than Massachusetts, Connecticut, New York, New Jersey, and our neighbors. And that's true. But I wouldn't do it if I didn't think we were ready. On the call we just got off of with public health experts and other governors in the White House, it's clear that each governor has to look at the situation in our states. And right now, in Rhode Island, we're testing the most number of people per capita. Our cases are going in the right direction. Our hospitalizations are plateaued. And I feel if we stay on this path, it will be safe under new conditions to begin a slow process of reopening on May 9th. Now, here's what I want to say. What's it going to look like on May 9th and May 10th? It is not going to look radically different than it does now. And if it does, if we start to see crowds and bunching, then we're doing something wrong, and I'll have to go back to more restrictions. Phase one, I want you to think slow and steady, patience, and flexibility. I also want you to keep in your mind, keep your network small. We want to keep our network small. We want to stay close to home, but the good news is we're going to get to start leaving our homes. And that is something that I hope gives everybody a smile on their face. It's time for us to think about coming out again in a slow and steady fashion, wearing our masks, avoiding crowds, maintaining 6 feet of distance, which by now we've become expert at. So my goal in step one, every governor's going to handle it differently. I'm focused on getting people back to work. So we've gone through in great detail who is out of work, who can I get back to work, how do I get the most people back to work as safely as possible, as quickly as possible. So to that end, we know that retailers and those employed in the retail industry have really, really suffered. Drive down any main street right now in any town in Rhode Island, the lights are off, there's the closed sign on the retailer, and we have a lot of people out of work. So in phase one, I will announce that non-critical retail stores that have been closed will be allowed to reopen their in-person operations, but with capacity restrictions, similar to what you're seeing in grocery stores now, only even more restricted. We're going to still encourage pre-ordering and in-store pickup as the best and safest option. However, we are going to enable stores to have limited in-person browsing. The number of customers allowed will vary based on the size of the store. And our commerce team, Stephen Pryor, has been doing an unbelievable job, truly, talking to retailers, talking to small businesses, listening to you, and trying to balance public health with your very real needs to reopen. So I'd ask that we could put up on the screen a visual of what the Commerce Department suggests could be the new look and feel in phase one for a small retailer. As you can see, The store is arranged for curbside pickup, but it also has clearly delineated a line with markers on the ground that are at least 6 feet apart as you enter. The store is also prepared for in-store pickup and browsing. It's going to be set up similar to what you're used to now in a grocery store. You have to wait outside if there's too many people in the store. You have to wait 6 feet apart. And retailers will be able to have one person browsing for every 300 square feet of space. That, by the way, is the model we're using now in grocery stores for the hours that accommodate seniors. Every staff member who works the retail operation and every customer will need to wear a cloth face covering. You'll notice on the screen there's a barrier between the cashier and the customer, which is what you see now in most grocery stores. And we're encouraging retailers to make it easy to either pay in advance or to use a contactless payment system in the store, because we want to make it quicker. We don't want you lingering in stores and browsing for a long time, and frankly, we just want to cut down on personal contact. I know this is going to be hard for retailers. Some of you may not be able to open with such limited capacity, and I want you to know we're going to work hard to get into phase 2, where we can relax these restrictions so everybody can open. If you're confused about, if you just need guidance, you can call the Department of Business Regulation. You can call the Commerce Department, and we'll try to walk you through it. I hope the visual helps. All of this is going to be online later today. But come a week from today, assuming I've lifted the stay-at-home order, if you're a retail operation that can comply with these new rules, go ahead and open your doors, and let's get your sales going again. I want to take a second to talk about restaurants. Restaurants, as I said last week, are not really going to be opening in phase 1. Having said that, opening a restaurant is complicated, and we've been having many, many conversations with restaurants, big and small, and the Hospitality Association. So I want to give you a feel for how we're thinking about it, what you can expect in phase 1, and where we're going with phase 2. It goes without saying that restaurants, like retail, have just been crushed all over the country. And so this one looms heavily on me to try to figure out a way to get you back in business. So maybe you could put up the restaurant photo. So, and I'm putting this up because restaurants are going to have to do a lot of thinking now in order to be able to reopen down the road. On the screen is a mock-up of what a restaurant might look like. As you can see, the inside of the restaurant is entirely closed, except for people coming in for pickup orders. So that's phase 1. That's what we intend for phase 1. We're not in phase 1 intending to enable in-store dining or in-room dining. We are hoping to help accelerate some of the takeout options, and Commerce will have detail around that. Like retailers, we're also encouraging restaurants to make it easy for folks to do curbside pickup. Now, for those that have the capacity to do outdoor seating, we are hoping to be able to enable that into phase 1. Not Monday, wait for another announcement, but into phase 1. And as you can see from the drawing, tables must be set up in a way that ensures social distancing. Seating will be by reservation only, and there likely will be no frequently touched and reused objects. So think of a menu, condiments, silverware will all have to be individually wrapped. The staff will have to be wearing masks. So it's a very different form of dining than we're used to. I also know not every restaurant today is capable of doing outdoor seating, and I'm fully aware that some of you may just skip phase one. Having said that, I would encourage you now to get creative. Maybe you don't have an outdoor dining area now, but maybe you could convert part of your parking lot into outdoor dining. That satisfies all of these requirements. So start thinking now to get creative, and we are going to continue to work with you. Our commerce team and our Department of Business Regulation team wants to work with you. We're also in constant contact with mayors and town managers. They want to work with you. We want to enable outdoor dining to start in phase one for as many restaurants as possible. Dining and other kind of close in contact businesses, salons and the like, will definitely be the focus of phase two. To remind you, assuming things go well, phase one is probably 14 days. And then we move to phase two. I want to take a minute to talk about office-based environments. So I will begin by saying thank you. When we started this, offices were, many of them worried, how will I be able to do this? And you've done an amazing job. Most of you are working from home. Most employers have enabled people to work from home and continue to get paid. You're using Zoom, you're using teleconference capabilities, you're using different kinds of technology that you previously hadn't used. And it's been inspiring and incredible for me to see the speed with which you've adopted your businesses to enable people to work from home, and I want to thank you for doing that. As a reminder, if you're a small business or a small retailer and you're still struggling to sell things online, set up a website, enable e-commerce, enable people to work remotely, please call 521-HELP. It's the Commerce's Help hotline, and we still have available free technical assistance for businesses who need a hand adopting your business for remote working or for any kind of new technology. Okay, so during phase one, if you can work from home, you should still work from home. And that's really most people. Lawyers, accountants, HR workers, financial folks, software engineers. Most of you can work from home, and you should still continue to work from home. Some of you, maybe you cannot work from home and you work in an office, and so you folks can start to come back to work in your office. Also, I understand if you can work from home, there's reasons that you need to be in the office. Maybe you have to get together with a colleague, maybe you have to have a meeting with your boss, maybe you have to get your software updated on your computer, you left some papers in the office, you have to pop in and collect some materials. I would say, that is fine. What's not fine is returning to normal right away. Remember, go slow, go steady. Not fine is returning to normal right away. Not fine is if you have a job that you've been doing at home for a month, perfectly fine. You should not automatically start going to the office every day. Not in phase one. In phase two, but not for these next 2 weeks. Please. Not fine is congregating in the office. Still, 6 feet apart, wearing your mask, washing your hands at all times. So part of my decision in going forward before some of our neighboring states is that phase one is slower and more limited. And that means, if you've been working from home, it's inconvenient but fine, I'm asking you in phase one to keep doing that. And if you're hearing me say this and you run a bank, a law firm, an accounting firm, a financial institution, the state, I'm asking you to let your employees continue to work from home for phase one for 2 more weeks. With limited exceptions, to pop into the office, sometimes, as I just explained. I think we have an office chart as well, if we could put that up on the screen. Workplaces are going to have to adopt new safety standards. None of this for the next year is going to be back to normal, what we think of as normal. So, and we're all going to have to continue to do our part to keep other people safe. All workplaces should start to think about this stuff now. That's why I'm making announcements today, a week in advance, so everyone can start thinking about it. It means I want you to start thinking about developing staggered work schedules. Let folks work in shifts or in pods. Remember, we want to limit our network. We don't want to be seeing a lot of different people every day. So stagger your work team so you're in the same team on a daily basis. Every employer is going to have to screen every employee every day to make sure they're not sick, and they're going to have to require people who are sick in any way with any symptoms to stay home. Common spaces like break rooms should be closed, and every accommodation should be made to keep people 6 feet apart. In a conference room, 6 feet apart. It also means you need to start thinking about more frequent cleaning and having the necessary supplies and frequent cleaning of desks and chairs and such. A lot of businesses are saying, assigning a desk to someone. This will be my desk and my pen and my chair for the next month. And it must be cleaned regularly. I will be back later this week with some more details around which of these are guidelines and which are these are enforceable, for lack of a better term. And we're going to have a whole day this week dedicated to just that. But for now, I wanted to give you a flavor of what phase 1 might look like. So phase 1 looks like being able to go to a shop and pick up some things, do a limited amount of browsing in retail. Looks like popping back into the office on occasion if you need to. At the end of phase 1, maybe we can go out for dinner outside. And all looking forward to phase 2 when we start relaxing some of these requirements. In addition to retail, where we've lost a lot of jobs and where we think it's safe to reopen, we are also going to be focused in phase 1 on getting a lot of our healthcare workers back to work. So you have heard me every day thank the many healthcare workers who haven't had a day off, and there are many, many of them in nursing homes, in hospitals, in other settings. Having said that, we also have many, many healthcare workers who are out of work because hospitals have stopped non-critical procedures, elective surgeries, dentists have scaled way back, on and on. Even primary care, people are afraid to call their doctor and go see their doctor. So to that point, we're also going to be leaning in phase 1 to getting a lot of healthcare folks back to work. In phase 1, anyone who has deferred healthcare needs, which by the way is a lot of people, if you've deferred your immunization shot, deferred a well visit, deferred a specialty care visit, we want you to pick up the phone and call your primary care provider and go ahead and set up appointments. We want you to start getting back out there. It's very important to keep yourself healthy. So if you've been deferring seeing your doctor, it's time to get back out there. In the first instance, call your primary care provider and go ahead and start to set up appointments. Telehealth is being increasingly used. It's also being paid for by insurance companies. It's still a great option. So continue to use that. But you can't get an X-ray with telehealth. You can't get an immunization with telehealth. You certainly can't get a elective surgery with telehealth. So we are going to start relaxing a lot of the requirements for our allied health professionals and other health professionals and specialists and doctors in phase 1. Specialty providers like orthopedists, neurologists, cardiologists, are open. They've remained open, and we're going to encourage you to start going to see them more during phase one. Certainly, time-sensitive or emergency procedures at the dentist office are continuing to happen under new safety guidelines. And certainly, if you have an emergency, please go to the emergency room. We're also working with our hospitals to enable them to start reopening for elective procedures and elective surgeries. Later this week, I hope to have specific announcements around which hospitals are coming back on which days, but I'm previewing for you that in phase one, we want to start to see a lot of our healthcare folks get back to work under all new infection control plans, mask wearing, et cetera, and to allow people to start getting the health care that they've deferred. And there will be a lot more guidance in more detail this week from the Department of Health as it relates to specific specialists and what you might expect. But for the average Rhode Islander, just know that if you've been putting off health care, call your doctor, because in phase one, we're going to be enabling you to get out and see the doctor. Finally, I want to make a special note about visitation to nursing homes, hospitals, and assisted living centers, and sadly say that we will not be allowing any visitation during phase one. Now I say sadly because I think that's really tough. Mother's Day is on Sunday. A lot of us haven't seen our loved ones for 2 months. We used to see them every day. Now we haven't seen them in months. However, if we know one thing about this virus, we know it is not kind to those who are frail, to the elderly, to people with underlying health conditions. And so at the same time that we're going to be slowly allowing people back to work because we have to get commerce going, we unfortunately have to double down on our efforts to keep the most vulnerable among us safe. So in phase one, we will not be allowing visitation to hospitals, assisted living, or nursing homes. And I'm saying that now because that's very hard, and I'm asking you now to make plans. To make your plans now around how you're going to continue to stay in contact with your loved ones without actually being able to see them. So that was a little bit long. I apologize, but it was a lot of information to get out. We'll have a PowerPoint online later today. If it's not already up there, we'll have pictures. And throughout this week is going to be a lot more detail with specific regulations and also technical help. Let us give you a hand. Call Commerce if we can help you. As I'll end by saying, we're going to have to be flexible. We're going to have to be patient. We're going to have to work with each other. And I am completely confident that we're going to stand this economy back up in phases and keep Rhode Islanders safe in the process. So with that, I'll turn it over to Nicole.
Thank you, Governor. Good afternoon, everyone. Thank you for joining us today. To the Governor's credit, with her leadership, a tremendous team of people have been working together to provide these phases for reopening the economy slowly, cautiously, and letting it be so that we can return to a different approach at accomplishing what we were doing safely. And I'm honored to be a part of the public health guidance based on science, based on our data, to help lead that and fulfill that process. So I want to thank Dr. McDonald for filling in yesterday. I know that's something that many of us appreciate and enjoy watching. I'll begin first with the data. We have 175 new cases. Of our COVID-19 patients, 339 are currently hospitalized. Of those people, 84 are currently in the intensive care unit, and 61 of those 84 are on ventilators. Sadly, as the governor has mentioned, we have 21 new COVID-19 associated fatalities to report. It is important for us to acknowledge that our thoughts, prayers, and deepest condolences are with the families of those who have passed away. To share a little more, these people range in age from their 40s to their 90s. One person in their 40s, two people in their 60s, and one person was in their 70s. Most of our unfortunate fatalities are among people in their 80s and in their 90s. 8 of the people who passed away were in their 80s, and 9 of the people who passed away were in their 90s. So, to move a little bit further into what reopening the economy is going to look like and what's needed to help ensure that everyone feels safe as we take these steps cautiously and steadily. We have been talking about the comprehensive approach. We've seen from our data and the modeling that was shared on Saturday that the social distancing measures and our comprehensive approach can be effective in shifting the steepness of the curve and flattening it. We know that social distancing, the 6 feet apart, is important. Everyone wearing their masks is important. Access to hand sanitizer and washing your hands, all of that is important. As we move forward, we'll want to really rely on those critical elements that we know make a difference. The other part that we have spoken of that's important for going into phase 1 is the robust testing program that we have that allows us to identify people, get those who have COVID-19 isolated effectively and safely, and contacts of those people, get them to be quarantined. That separation is what allows us to stop the virus from being transmitted from one person to another. So the testing piece is one element of this comprehensive toolbox that allows Rhode Island to stay in front and to present an opportunity for you and all of us to feel safe going out. Our testing approach has 3 major components, and I've already shared with you the first 2. We know that we have an expanded testing program that's really focused on testing everyone who has symptoms. Our focus is to get all of those tested with symptoms within 48 hours. And we continually look to expand the number of sites and mobile testing capabilities for our high-risk and high-need populations. It's what's going on at the CVS site, it's what's going on at the other drive-through sites, and the walk-through sites that we've talked about in the various communities across Rhode Island, focusing on people who have symptoms. The second major approach for our testing is also something that you are aware of. It's our rapid outbreak response. I went into that in depth when I shared about our nursing home response, how comprehensive and aggressive we are. If there is one positive case, we can go into a specialized setting like a congregate setting, a nursing home or a group home, and test not only the one person who had symptoms, but the folks around that person who may not have symptoms but were contacts or who were in the facility, more so that we can understand what's going on in that environment and rapidly respond to the cluster of cases that's there. That's also going to be a critical step for us going forward, being able to go in quickly, do comprehensive testing, get people into isolation and quarantine, and make sure the appropriate infection control steps are in place. The third major area of our testing strategy is going to be being able to test people who are just in the community so that we can better understand how coronavirus, COVID-19, is impacting people in all elements of our community, in our workforce, in our retail, in other settings, and then be able to rally around that and have a response that allows us to continue to keep people safe, getting them into our contact tracing program, getting them into isolation and quarantine effectively. So I'm going to continue to share more in the coming days about this third expanded type of testing, but want to get started with just giving you a taste for today. One of the things that we are going to be doing with that third approach is testing at places where workers are still interacting with a lot of people face to face. The more we can understand about that, the better we can be in our response, and the better data we can have about how to go to the next phase safely. So for this element, we have worked with leadership of 4 stop and shop sites locally across Rhode Island, and we're going to be giving their employees the opportunity to, if they want to, get COVID-19 tests. The tests will be the traditional PCR diagnostic test and an antibody test that will allow us to understand more about how those tests work together. I want to reiterate that testing for those employees will be voluntary. Something else for people to understand is that you cannot just go to Stop and Shop and expect to be tested as the customer going there. The focus for this approach is an opportunity that's opened up to employees only at this point to help us better understand. Our vision here is to use specific, representative samples of people and places to understand how much disease is in the community and get more information about how it can be transmitted so that we can have a better approach for the state as a whole. We do something similar to this every year with the flu. When we report out every year on what kind of flu season we're seeing, what we're doing is sharing estimates of how the entire state is being impacted based on some targeted representative sample testing that we did in specific locations that are generally reflective of Rhode Island throughout the state. Again, as I said, we'll continue to share more about this in length tomorrow on our plans for testing going forward, including how this fits into all portions of our strategy to make sure that Rhode Island is safe for everyone as we are reopening the economy. But wanted to make sure that you had a taste of the steps that we are moving quickly forward with so that we can gather the information, and as a Rhode Islander, you can be assured that we have a strong public health-founded approach to how we're going forward, collecting the data and making decisions based on that information and science, so that as we're reopening the economy, it's being done safely and effectively. So with that, I will stop and get us going with questions.
Good afternoon.
Hello.
We're going to begin with Ryan Belmore of What's Up Newport. Governor, he notes there's a lot of confusion on when wearing a cloth mask is required and when it's not. He asks, have you considered simplifying the message for understanding and enforcement? For example, requiring everyone to wear a mask at all time when in public.
It's a great question, Ryan. And tomorrow we're working on an executive order right now as it relates to face masks and just trying to get it right for the exact reason that you have said there, to make it enforceable and in the best interest of every Rhode Islander and frankly, practical. Here's what I will say. The reason I'm going to have to do that executive order is that at the same time that we're going to start relaxing the stay-at-home order and letting us go out a little bit more and stay close to home instead of at home, I'm going to have to be doing more things like additional restrictions, including mask wearing. So if you can hang on for a day, I'm going to sign the executive order and announce it tomorrow. But here's what I will say, and I thought Dr. McDonald did a great job of this yesterday. You really, at this point, we should all always have a mask on us. So if you're going for a walk by yourself or with someone, with whom you live, and you're in the woods and no one's around, well, you don't necessarily have to wear your mask, but you may run into somebody, and so you better have it on your person. Certainly, if you are going to work, while you are at work, while you are at the grocery store, while you are any place out of your house and not really alone in nature, you need to have your mask on. And so, again, we will clarify it with a new EO tomorrow, but I hope that helps for now.
Bill Bartholomew asks, I've been hearing very different reactions about your guidance and actions in recent times from Washington County versus Providence County from their listeners and readers. What is your message to those in less impacted areas about protecting the state as a whole?
Thank you for the question. So I have thought a lot about this. And when you look at a much bigger state, for example, I was just talking to the governor of Colorado. Colorado is a huge state, and Denver, he has kept the stay-at-home order in Denver, but for more rural places, he started to relax the stay-at-home order. In a place like Colorado, where there are many hundreds of miles in between the states, I think that, might make some sense. In a place like Rhode Island, which is the most densely populated state in America, where you can get anywhere, really, in 30 to 40 minutes, where we don't have a county government, there's no real county government, it's a state government and municipal government. For all of those reasons, I did not think it was a safe or appropriate approach to do a county by county relaxation. We are a small state, a proud state, we're one state, we're effectively one community. And so I decided, after a lot of thought and consultation, that what was in the best interest of all Rhode Islanders was a single statewide approach. More than 50% of our GDP, of all the economic activity in Rhode Island, is in Providence, which means that even if you live outside of Providence, chances are you're going to be in this area. So again, I did what I thought was in the best interest for the conditions in Rhode Island. And that, by the way, is something you're going to hear a lot from me. Density is the worst thing for this virus. Montana and Wyoming are in a very different place than Rhode Island. And I'm going to protect the people of Rhode Island the best way I know how.
Our next question comes from Michael Bilo of Motif Magazine. The New York Times is reporting that the federal government internally estimated the national deaths per day to double to 3,000 by June 1st. Rhode Island seems to be defying that trend so far, but can it escape being swept along?
Let me say two things. Yes, we are doing very well in Rhode Island because of the choices we've made and because the people of Rhode Island are doing an amazing job. I just said we had 95% compliance with mask wearing this weekend in our retail shops. That's fantastic. If we, the people of Rhode Island, continue to follow the rules as we are now, we, all the people of Rhode Island, will be safer, healthier, and spared some of these terrible consequences. Having said that, the bad news for us is we're stuck between two hot spots. As Dr. Deborah Burke said, Rhode Island is unfortunately stuck between two incredible hot spots, otherwise known as Boston and New York City. So, and as I've already said, we're very densely populated. We've done an excellent job, and that's why we are where we are. It's why you don't see hospitalizations and mortality shooting through the roof, and we're going to stay on that path, being flexible and adjusting as required.
Brian Crandall of NBC 10 News says state police are working an investigation on fraudulent unemployment applications in Rhode Island, and the U.S. Attorney's Office said it and the FBI are involved. What do you know about the extent of the fraud? Were there enough checks and balances at the Department of Labor and Training?
Yeah. So I can confirm that there is this investigation. And I can confirm that the FBI and the U.S. Attorney are involved, and I would ask you to direct your questions to them, because I can't comment on ongoing investigation. As to were there enough checks and balances, we are obviously looking into that, but my answer is yes. And this situation has more to do with the ability of bad actors to engage in bad behavior than it does to do with our checks and balances. If and as I'm allowed to say more, I will be saying more about that in the days to come.
Tara Granahan from WPRO Radio says, how are you ever going to be able to monitor every office, restaurant, and retailer for Phase 1 restrictions? And if they violate, what are the consequences?
Yeah. So a couple answers, and you make an excellent point. We're going to have increased enforcement. We will have more inspections, more people at DBR, more people at the Department of Health, more state police, more local police. You know, we're gonna amp it up to make sure people are complying. As it relates to consequences, as I said earlier, later this week, I'm going to be very clear around, which of these things are guidelines versus which of these things are regulations, and if they're regulations, what are the consequences for not complying. But also, we are going to be relying on industry organizations to help police their own industry. So the best example of this is the pledge that manufacturers have taken. They got together as manufacturers to say, we pledge to operate according to these new rules. We're working on a similar thing with the construction business. Every construction site, we want them to sign a pledge, these new rules. We may do a similar thing for retailers, restaurateurs, and hairdressers. Because here's the thing, it's in their interest that all of their peers follow the rules. Because if people don't follow the rules, and I have to, again, shut down the whole industry, that's bad for everybody. So the whole time I've been up here, I've been saying, look for ways to comply with the rules. Don't look for ways to get around the rules. And the truth of the matter is that's in your best interest. Because if you start to cut corners, everyone else is going to suffer.
Our next question is from Tanya Signori of the RI Echo. As for federal money and loans, some small businesses and restaurants were not able to receive money. Is there a way that future money can be given to those businesses first?
First of all, it's important to note that the PPP program, the Federal Small Business Administration PPP program, it's still in effect. It's not too late to apply. Now, the funds are getting exhausted rapidly, but it's still open at the federal level. So if you're looking to the Paycheck Protection Program, my recommendation is that you email Commerce at ppp@commerceri.com. We have been in dialogue with lenders locally and nationally that are opening up spots in their application process for the unbanked small businesses of Rhode Island. So please email ppp@commerceri.com. The governor has emphasized our focusing upon unbanked businesses and making sure they have a shot. So we've been helping small businesses process for weeks, and there are still opportunities to avail yourself of these resources. Now, having said that, can we help to prioritize smaller businesses going forward? Yes, as a general matter. Governor Raimondo has already been advising us and guiding us as we think about our stimulus dollars, the CARES Act dollars, to think about smaller businesses, and we'll have more to say about that when the governor is prepared to make those remarks in coming days.
Kim Kalunian of WPRI has the next question. With Rhode Island opening, is there any concern around people coming into the state from Connecticut and Massachusetts to visit our shops and restaurants?
Yeah. So it's a great question, and the answer is yes. I'm going to be back later this week with some detailed guidelines on how we intend to handle travel in Phase 1. So if you hang on a day or two, I can answer that more completely. But let me say this. If our shops are abiding by the rules, they'll never have anyone in there that's within 6 feet of each other. There'll be very limited browsing. So again, I'm going to have guidance on travel, but at the end of the day, the whole thing is avoid crowds, stay at home if you're sick, wear your face cloth covering, extra cleaning. And that is what is going to be very important. And that applies to somebody coming from Massachusetts to one of our shops.
Sophia Rudin of the Public's Radio notes, according to state payroll records, since August of 2015, the position of Chief Medical Examiner has not been filled except in an acting capacity. Why have you not filled this position?
We've worked very hard to get this position filled. We know that the examiner's office within RIDO's State Health Laboratories plays a critical role in the work that we do. And we really credit the commitment of those who have been in the acting role for the amount of time that's needed. They're engaged with us and fulfilling every element of the capacity needed. And we are continuing to be as creative as we can to attract the long-term, competent, strong leader that we want to continue to maintain in the Chief Medical Examiner's role. Know that we've done many, many interviews and are continually focused on getting this role filled.
Doctor, our last question is from Shannon Heggie. Are you now seeing people who've been in the hospital and the ICU for quite some time pass on? Could that lead to higher death rates in the coming days? And how long, on average, are people spending in the ICU before either getting better or passing on?
Yeah, this is an important question. There can be a time frame in which people who are in the hospital have lingering of their illness, with many of them ultimately getting better, and some, sadly, ultimately not getting better. For that reason, hospitalizations, we have shared, can be a lagging indicator. It takes time, several days after someone is infected with the COVID-19 coronavirus. They can end up in the hospital, and then oftentimes several days after that, we would see an unfortunate death if there is someone who does not recover. The amount of time can vary, on average less than about 2 weeks or so that we are seeing, and we're continuing to work closely and really appreciate those in the hospital, on the front lines, in our intensive care unit, who are doing everything they can to care for the people, using compassionate use medications that are available, and providing the ventilatory support and what's needed to help that person recover. So it is a challenging element to it, and we do see a lag or a delay in the numbers as a result, and it's something that we'll continue to follow closely as we reopen the economy, with the hope that everyone continues the mask wearing, the hand washing, and the social distancing, because we know that works. We know it's effective, and that's going to be critical as we reopen the economy. Thank you.
Thank you very much. Take care.